When someone in your household tests positive for COVID-19, knowing how to manage home isolation is crucial for everyone's safety. These guidelines are designed to help diagnosed individuals, their caretakers, and healthcare providers navigate the process with confidence. The main goal is to limit the spread of the virus within the home and community, while also reducing unnecessary pressure on healthcare facilities. By following evidence-based measures, you can ensure effective infection prevention and control. In this video, we'll walk you through the essential steps for home isolation, care for confirmed cases, and the responsibilities of caretakers. Let's start by understanding the basics of home isolation and why it matters. If you or a household member is confirmed positive for COVID-19, it's important to stay home unless absolutely necessary. Limit physical contact and keep a safe distance from others even within your home. If you need to go out, maintain at least 2 arms length, about 6 feet from others. Always consult your doctor before making decisions about your care, especially if you have underlying health conditions. Monitor for symptoms like fever, cough, shortness of breath, chest pain, confusion, or bluish lips. Keep a supply of medications and essentials ready. The ill person should stay in a separate room and, if possible, use a separate bathroom. Regularly wash your hands, avoid touching your face, and clean frequently touched surfaces. Stay updated on local health advisories and notify your workplace if you need to work from home. Remember, protecting those at higher risk, such as older adults or those with severe health conditions, is especially important. Caring for a COVID-19 patient at home requires extra precautions to protect yourself and others. Disinfect surfaces regularly and avoid sharing personal items like dishes, towels, or bedding. If possible, the sick person should use a separate bathroom and eat in their room. Both the patient and caretaker should wear masks when in the same room. Handle food service items and laundry with gloves, and wash hands thoroughly after each task. Use a dedicated trash can for the ill person and avoid shaking dirty laundry to minimize the risk of spreading the virus. Emotional health is also important. Support each other and stay connected with loved ones virtually. By following these steps, caretakers can help prevent further transmission within the household and maintain a safe environment for everyone. Isolation should last for at least 5 days for people with COVID-19. If symptoms are resolving and there's no fever for 24 hours, continue to wear a mask for another 5 days when around others. For those exposed to COVID-19, quarantine guidelines depend on vaccination status. Unvaccinated individuals or those without a recent booster should quarantine for 5 days, followed by strict mask use for another 5 days. If quarantine isn't possible, wearing a well-fitting mask for 10 days is essential. Testing on day 5 after exposure is recommended. Special rules apply to immunocompromised patients and healthcare workers caring for them. They must have 2 negative molecular tests at least 24 hours apart before ending isolation. These protocols are regularly updated to reflect the latest health recommendations, so always stay informed through reliable sources.